Hey everybody, I am Sifu Bodhi. Thank you so much for sharing your Qigong practice with me today. Well, today we are going to be exploring Qigong for knee pain. And if you haven't already, of course, please hit the subscribe button. Now, we released a Qigong for Knee program not too long ago, and since its release, we've had over 55,000 people use that program. So incredible. I'm so honored that so many of you have used the program to help yourself with pain in the knee. So today I wanted to release a companion program to go with that initial program that we did for the knees. And this one is going to be more about strengthening the musculature around the knee, both below from the anterior tibialis and the soleus and gastroc to the inner and outer thighs, the quads, the hamstrings, and the glutes. All these affect the knee, the stability of the knee and health of the knee, and of course, decreased pain. And we're going to be using all isometric or non-moving contraction. And this is taken from some of the Shaolin training that we do, the muscle tendon and changing organ exercises, where we use isometric contraction done with breathing pattern. So, as always, let's start things off with a few cleansing breaths. So sitting up nice and tall, and today we're going to be doing this practice. Vast majority of it is going to be seated today. So for any of you who are limited in mobility, this is going to be a great practice for you. But if you have full mobility like myself, absolutely, still a great program to do. So sit nice and tall, lift from the crown of the head, and let's take a deep breath in. Visualize gathering white light all around the body as you breathe in. And as you breathe out, pulling it down, filling your body, melting all tension down into the ground. In 2. And melt. In 3. And melt. In 4, melt, and in 5, and melt. On that exhale, we're going to allow the hands to come down to the thighs. Now, we're going to begin our practice with the front of the shin. These are the anterior tibialis muscles, these guys here in the front of your shin. And we're going to look to strengthen those by moving into what's called dorsiflexion. We're going to lift the toes up as high as we can. And we're going to be holding this contraction as forcefully as we can without pain for a count of 5 long diaphragmatic breaths. And we're going to do a nice extended diaphragmatic breath each time. So, weight is on the heels, sitting tall. Lift the toes as high as you possibly can, flexing that shin. You'll feel it quite quickly. And take a deep breath in and out. And here we're going to breathe out through the mouth. In 2 and out. Toes nice and high. In 3 and out. In 4, really flexing those toes up. And out. And in 5. And out. Good, gently relax the legs back down. So by then you'll already start to feel a little bit of burning in the front of the shin. So now we're going to step the feet in a little bit closer. And we're going to go up on the tippy toes. And in this bent knee position, we're actually going to affect both soleus and gastroc, so the upper and lower calf. And here we're going to push the heels as high as we can, flexing the calves as tightly as we can. Ready? Deep breath in. And squeeze. In 2. And squeeze. In 3. Squeeze. In 4. Squeeze. And in 5. Squeeze. Good, gently relax the legs back down. Now with any of the isometrics that we're going to be doing today, it's really, really important two things. One, that you're hydrated. And a simple way to check hydration, because once again, number one cause of muscle cramping is either dehydration or electrolyte imbalance. So really simple way is you can actually just take the back of your hand and feel on the skin of your forearm and on the skin of your hand. And if the skin of your hand is hotter than your forearm, it actually means your body's being damaged by dehydration. So it means you need a drink right away. So a simple way to check. Now if you are drinking your 8 cups, that's your 2 liters a day, and you're still having this hotter hands, this typically means that there is a mineral deficiency in your body, typically magnesium or potassium, that you're not holding onto fluids. And so therefore you may just need a good magnesium supplement, something like magnesium glycinate, which is easily absorbed in your body, or just using an electrolyte for a few days. And this happens, a lot of people nowadays are they're using a lot of sauna, or if you're just a heavy sweater, or if you're having hot flashes and night sweats, you can throw off your electrolyte balance really easily, and it actually does take 3 days to rebalance your electrolytes, even if you're taking electrolytes consistently 3 days in a row, just to get you back to balance. So let's keep moving up the leg. And so now we're going to move above the knee, and we're going to move to our outer thigh. These are our abductor muscles that pull away from the body. And so we're going to restrict them by just placing our hands on the outside of our knee, and we're going to push against our hands, trying to push our knees apart while we restrict. The unmovable object is us. So sitting tall, hands on the side of the knee or side of the thigh, whichever you can reach, it's totally fine. You just want to have some pressure that you can push out against. So take a deep breath in and push. In 2, keep that pressure on, both on inhalation and exhalation. In 3, nice and strong push. 4, push, and in 5, push. Good, relaxing down. And this is actually activating the sides of the hip region, what's called the TFL, tensor fascia lata, and the gluteus medius. And these are the guys that help with lateral stability, especially as we age. The ability to catch ourselves when we fall or we tip to the side, super, super important. And just a little bit of pressure against that is a great way to strengthen that lateral compartment, and once again helps stabilize what's called the vastus lateralis, outside head of the quad, and activate all the tissue that goes down the side of the leg, known as the IT band. This attaches to that TFL and gluteus medius, and then wraps all the way down to the top of the fibula, outside of the knee, the lower bone in the shin area there. So we get great activation by moving into abduction. Next, we're going to move to adduction, so pulling the legs in. And so for this one, we're going to place the hands on the inside of the thigh, and we're going to be pushing out with our hands as we push in with our knees. Same thing, sitting nice and tall, pressing nice and hard. Remember, both on inhalation and exhalation. So take a deep breath in and push. In 2, push. In 3, push. In 4, push. And in 5, push. Good, relax. You know, it's really quite neat because the inner thigh muscles, the abductor brevis, longus, and magnus, this is a part of the deep front line, which actually is connected to your abs. So by contracting and strengthening your inner thigh, which are internal rotators, they actually activate your abs at the same time. So you get this connection, which helps you to maintain a normal position in your pelvis, which is going to help your lower back. So remember, all of this stuff is connected. Even though we're focusing on the knee today, we're having that effect because we always want to think holistically. We always want to think unified movement. That's always Qigong. But our intention is always to unify the body and connect everything together. So we're going to keep moving up the back of the legs right now, and we're going to move up into the glute. And so what we want to do is we want to tie in the hamstring. That's the back of the leg, and that's basically your leg bicep. Right? So the flexion of the leg is same as the arm, is same as the bicep. And so to activate this very easily, all we have to do is actually contract the glute. So if we just squeeze the cheeks together and press the heel into the floor, we get a great contraction over the entire back side, the rear side of the lower leg. So we are going to push the heel down, and we're going to squeeze the glute hard as we possibly can. Sitting tall. Here we go. Deep breath in and squeeze. Press the heels, squeeze the glutes tight. In 2, squeeze. In 3, squeeze. In 4, squeeze. And in 5, squeeze. And relax on down. Whew. Okay, so for our last exercise, we want to get the front of the legs and the quadricep muscles, the vastus lateralis and medialis, rectus femoris, intermedius, all these 4 muscles, they actively track the knee through the groove and make sure everybody's happy. So for this one, we're going to finally stand up to a standing position. And all we're going to do here from a nice relaxed position is something we don't often do in Qigong, is lock the knee. And we're going to lock the knee totally straight, keeping our pinky big toe heel evenly on the floor, and we're going to flex and squeeze the front of our thigh, our quad muscles, as tightly as we can. The upper body's going to stay nice and relaxed, and all you're going to do is flex and squeeze those muscles. If you have trouble connecting to that flexion or to that activation, just push the knee back, and that'll do the job. So take a deep breath in and squeeze. In 2, nice and tight. Squeeze. In 3, squeeze. In 4, squeeze, squeeze, squeeze. And in 5, squeeze. And come on back down to a seated position here. So once again, we've gone through front of the shin, the calves, the outer thigh, the inner thigh, the outer thigh, the hamstring and glute, and then finally to the quad. And this is going to hit all the muscles that are going to stabilize the knee and make sure the knee is strong as possible, all the muscles surrounding the muscle. And remember, the more strength we have in the muscle, the less the joint and the connective tissue has to do. And this is how